The American Board of Orthopedic Surgery has been establishing education and performance standards for orthopedic surgeons since 1934. In this video, you'll learn how the ABOS works in the best interest of the public and medical profession by setting standards for competence and education through each stage of a board-certified orthopedic surgeon's career, from residency and initial ABOS board certification to lifelong education through the ABOS Maintenance of Certification program. The American Board of Orthopedic Surgery was founded as a private, voluntary, nonprofit autonomous organization. Currently, there are over 29,000 ABOS diplomates. There are many different orthopedic organizations, but the ABOS is dedicated only to board certification. We're not a membership organization, and while we treat our applicants, candidates, and diplomates as our constituents, it's important to remember that the ABOS exists to serve the public and our patients. By assessing an orthopedic surgeon's knowledge, skills, and professionalism as they begin their practice and throughout their career, we provide an important service to patients and the public, allowing them to make intelligent and informed decisions regarding their healthcare providers. We strongly believe in the benefits of physician self-regulation. Orthopedic surgeons are the best group to set performance and safety standards for our profession. In the absence of physician self-regulation, it's very likely that another, less qualified group would step in to ensure that patients are receiving safe, ethical, effective surgical care. The ABOS Board of Directors is made up of 21 directors, 20 practicing orthopedic surgeons, and 1 public member. All are volunteers. We turn to 3 professional associations to nominate directors. Nominations come from the American Orthopaedic Association, the American Academy of Orthopedic Surgeons, and the American Medical Association. Besides the public member, directors are also diplomates of the ABOS who undergo the same certification and maintenance of certification standards as their fellow orthopedic surgeons, meaning they understand the pressures and responsibilities of practicing orthopedic surgeons. We believe it's important to have a diverse board of directors. We strive to have our directors represent different genders, races, ethnicities, practice settings, subspecialties, and regions of the country. The ABOS has a dedicated full-time staff that works out of Chapel Hill, North Carolina. Our staff includes certification specialists who answer questions about the ABOS residency requirements, board certification, and maintenance of certification processes, and are responsible for helping our diplomates maintain their ABOS board certification status throughout their careers. The ABOS establishes education and performance standards for orthopedic surgeons at all stages of their careers, beginning with residency training. Along with the medical education community, the ABOS is transitioning from time-based verification of acquisition of knowledge and skills in residency to promoting competency-based verification. The ABOS believes it's more important that a resident master a set of skills rather than just completing a 5-year residency program. The ABOS sees the value in providing residents and program directors more information and more responsibility as residents acquire the necessary skills in the areas of medical knowledge, patient care skills, and professionalism during their residency education. The ABOS's new Knowledge, Skills, and Behavior program helps residency programs standardize their requirements. This program puts residents in charge of their education, using mobile-friendly assessments to solicit immediate feedback for procedures they perform. Once an orthopedic surgeon has successfully completed an ACGME-accredited orthopedic surgery residency program, they're ready to begin the process towards ABOS board certification. Candidates must pass 2 examinations to achieve ABOS board certification. The Part 1 examination is a timed, computer-administered multiple-choice examination. It evaluates a candidate's knowledge of general orthopedics and the basic science of orthopedics, as well as a candidate's ability to use this information for problem-solving in the diagnosis and treatment of patients. A physician who successfully completes the ABOS Part 1 examination is considered board eligible, and that eligibility extends for 5 years. After passing the Part 1 examination and developing an orthopedic surgical practice, ABOS board-eligible physicians can apply to take the Part 2 oral examination, in which 12 of the candidates' surgical cases are evaluated by volunteer ABOS board-certified orthopedic surgeons. This process involves a review of 6 months of surgical cases and an in-depth peer review program. After passing the ABOS Part 2 examination, a surgeon receives an ABOS board certification certificate and becomes an ABOS diplomate and then enters a 10-year maintenance of certification cycle. As surgeons, we have a commitment to our patients and our profession to keep our knowledge and our skills up to date and current. Medical knowledge turns over on average every 6 years. Both the ABOS and our partner orthopedic organizations share a belief that a surgeon's certification should be revalidated over time because it ensures that diplomates are knowledgeable on the latest information and technology available. Studies show a correlation to greater adherence to practice guidelines, fewer state board disciplinary actions, and most importantly, higher quality, less costly patient care when that surgeon is assessed on a regular basis. Over the past few years, we have introduced numerous improvements to the recertification process, leveraging technology to streamline our processes. The ABOS Maintenance of Certification, or MOC program, is a peer-developed system of ongoing professional development and practice assessment and improvement. It's designed to reflect the critical core physician values of compassion, patient-centeredness, and a passion for education. The ABOS has structured the ABOS MOC program to accommodate activities which orthopedic surgeons are already doing in their practices, making the program valuable and relevant for ABOS diplomates. We hope this video has helped to shed light on the ABOS as an organization, the principles that guide the ABOS, and the ABOS board certification programs. Our goal is to continually improve our programs, increase the value of ABOS board certification, and serve the best interest of the public in our profession, and to always do the right thing.